Good afternoon, everybody. Hello.
Namaste, sir.
Namaste. Am I audible?
Yes, sir.
Okay. Should we start our class now,
Yes, sir.
or we'll wait for some time to your friends, those who are willing to join?
As we wish, sir.
Okay. So we'll wait for another 4 minutes,
Okay,
two,
sir.
3 minutes, then we'll start. Okay.
Okay, sir.
Good afternoon, sir.
Good afternoon, good afternoon.
Sir. Sir, should I start class?
Yes, you start.
Okay. Thank you, sir. So once again, I extend my heartily congratulations and I wish to each and everybody uh, good afternoon to once again everyone. Today we have assembled for discussing the social work practicum and supervision. This subject is very, very important so far as the social work practicum is concerned. And as you know, already we have completed 3 classes, block 1, block 2 and block 3. That is social work practicum and supervision. And today, this class is the last class, uh, which is block 4 of social work practicum and supervision. So this block 4 is basically uh, the heading of this block 4 is social work practicum in various settings. Social work practicum in various settings. Unit 1, individuals, family and community. Unit 2, medical, psychiatry and child care. Unit 3, education and research. Unit 4, correctional services. Unit 5, corporate sector, donor agencies and NGOs. Friends, this subject, today's block 4, social work practice in various settings, this is very, very, important chapter. You need to understand carefully. If you are getting any confusion, then at the end of the class, we'll have a discussion session so that you can have any query or any doubts you can ask to me, and then I will try to answer you all. So, social work practicum in various settings. Let me tell you, whatever units are, the 4 units comprises of different settings, right? So it has been segregated in different areas. So we'll be discussing one after one. Settings mean, let me tell you first, settings means different area or the scopes where the social work can practice. The social workers need to get a field, social worker needs to get a place, social worker needs to get a area where they can practice, right? So basically, we have 6 methods that I have already told to you: case work, group work, community organization, social action, social welfare administration, social work research. These 6 methods we apply in different fields as per the needy, as per the applicability. So therefore, these are some of the areas or the various settings which we can say, or scopes, where we can utilize the social work. And basically, whenever we are doing any kind of activities, say it is field practicum or whatever kind of activities, we are we supposed to do in these particular areas through the fieldwork service or through the agency service, or any particularly when we render the social service. By that time we have to go for these providing services in these uh, settings or areas, right? So unit 1 Individual, family, and community. What is individual, what is family, what is community, that you know. So how the individual, how we can work with the individual, how we can work with the clients, how we will work with the clients problem, that we will be discussing under unit 1, also family, also community. Okay, so now we'll be discussing individuals, family, and community. So let me tell you one thing. Fieldwork with individuals, I have already discussed with you in the previous classes also, that you know that uh, working with individual is casework. Working with individual is casework. When a caseworker, when a client comes to a caseworker with some problem, and the caseworker when helps him, is called a casework. So now, sometimes when we are placing in any kind of agency, there we have to do, or there we have to undertake some of the case studies. So how we will do that, those case studies, that is very much important. There are some, the case workers, some artistic qualities. All cannot do the case work. Those who have know the principles, those who have know the component of casework, those who have know the process of casework, they only can do effectively of casework, which we are saying working with individuals. We are saying it is working with individuals is one of the method of social work. So the certain criteria that need to be the field, the trainee or the students will know some of the experience by doing some sort of casework. So what kind of learning he will gain out of doing the case service? The learning experience during fieldwork must give the students the opportunity to perform the kind of behavior applied by the fieldwork objectives. So learning opportunity will give you some of the uh, important, I mean, knowledge, through which you can able to know more knowledge about the field practicum. So now we will come directly to the fieldwork with individuals. As I was saying to you that when a suppose when there is a person having the problem and comes to an agency to seek the help from the social caseworker, is called the social casework. As I was saying to you, if there is a problem, a person having the problem comes through an agency to get a help from the social worker, is called the casework. That is why I was saying to you that component of social casework. Under this component, if there is in casework, there must be a person. A person may be a child, a person may be a young, a person may be adult, a person may be any male or female, whoever may be, who having some kind of problem, and he is seeking the help of a caseworker or the social worker, is called the casework. But he should come through the agency. Now, casework service, providing casework service is a artistic quality. Everybody cannot do this type of activities. So therefore, this is very important that who is doing the casework, he must have knowledge on case service. So learning goals for field practice with individuals. What is the learning goals for field practice working in among the individuals? To provide the students with experience in using casework concept, components, principle, and techniques. So in the previous chapters also we were discussing that when you are teaching about the casework, by that time you have to understand the concept of casework, the component of casework, principle of casework, and techniques of casework. As I was saying to you that there are 7 principles of casework, that is IPAN CQ, in the short form IPAN CQ, I was describing with you all, that is individualizations, um, confidentiality, purposeful relation of the client, etc. And every techniques having some sort of every methods have some techniques. In case work also there are some techniques that also we have discussed. That is maybe interviewing, counseling. These are some of the techniques. So while you are dealing with with the client, by that time you should know the basic knowledge of this case study to enable the students to develop his concept of professional self and its differential use, to facilitate the experience of going through the entire process of social casework, that is intake process, diagnosis of the problem, treatment plan, implementation and evaluation and follow-up. This is the process of social casework. While you have undertaken any kind of social casework, then the you have to go through the process. What sort of process is there in social casework? Number one, intake process, diagnosis of the problem, treatment plan, implementation and evaluation and follow-up. So first you have to intake, or first you have to accept the client as your client, that is the intake. Number two is diagnosis. That means you have to diagnose whether the intensity or the depth of the, I mean the problem, or how, what is the exact disease, or uh, how long he is suffering, and what nature of the disease, everything that you have to diagnose. And then you will come to know the problem, diagnose the problem. Then treatment plan. Treatment plan, what kind of treatment you supposed to give, how many, how long you will provide the treatment, that you have to make a plan. Then after planning, then you are going for the implementation. That means treatment will start. Then in due course of your treatment, you have to evaluate. That means whether the client is improving or not, or it is as he was, that you have to study. If you are not studying that the improvement of the client, then your service, your treatment will be valueless. Therefore, you have to evaluate, and then you have to, after the evaluation, you have to wind up, and then you have to follow up. So follow up is also very much important. I'm not saying that for years together you will go for follow up, but in some cases you may be following it for 1 month or 2 months or 6 months, like that also. Because when we give treatment to any patient, we should not give up at a moment. So for certain period we have to follow up. Then only the disease could be getting clear. So now, in the preliminary stages, while you are starting the um, providing the services, by that time you need to have a good relationship with your client. Professional relationship, I was saying to you, build professional relationship with client. That is very much important. And that's why I was saying to you that in case where relationship is the nucleus part, significant part. So without having relationship, you cannot start your case study, because the uh, client will not cooperate to you. The client will not feeling comfortable to you. The client will not feel conducive to you, unless he is not conducive to you, unless he is not feeling comfortable with you. You cannot able to know his internal problems, external problems, etc., etc. So therefore, relationship is very important. And then rapport building skills should be used effectively during this stage. Means in the preliminary stage, what you will do, you have to build the rapport, you have to keep the relationship, and then you are going for providing the service. Then in short, I was saying to you What is diagnosis? The students has to discuss the details of the case with agency personnel as well as the faculty supervisor to understand all the facts of the cases. So, while you are diagnosis, by that time you have to interact with the agency supervisor. You may be interacting with the neighbor of that particular person. So, through that you can explore more information from um, uh, the client, and that will be help you for solving the problem. Then treatment phases. That treatment phases, I was saying to you, students go to the field with the knowledge that treatment goals generally fall in four categories: curative, rehabilitative, preventive, and promotional. These are the four category. I mean the mm, treatment phases through which you can provide some sort of treatment. So, in previous classes also I was discussing what is curative and rehabilitative. Also, preventive also know, and promotional also Okay, so this type of treatment you supposed to give, and if it is beyond your capacity, then you may be referring somewhere else. That is also there in your social casework. If you are not able to give proper treatment, then you can refer to somebody who is capable enough to handle that case. So no need to worry for that. Then evaluation, as I was saying to you, whatever inputs you have given, whatever treatment you have given, whether it is up to the mark, whether it is working or not, that you have to evaluate, and then by through the evaluation you came to know that the status of the disease, the status of the case, and then you will go for solving the problem. Now, the very important part of this social casework is skills required of social casework. What are the skills a social caseworkers um, have to um, have? What are the skills required for a social caseworker? That we will be discussing. Number one skill, skills in building relationship. You know, all people cannot able to have a good relationship with others. It is a skill. Within a moment, within a fraction of time, some people can build relationship. I can cite an example that suppose you are traveling from one place to another place through a train. So you are sitting in a compartment. In front of you, somebody is sitting, but sometimes, suppose 2 3 hours or 5 hours or 10 hours, whatever, one day or 2 days, maybe you are traveling, but sometimes what happen, you are not able to interact with your fellow man who is sitting in front of you. But there are some people who will interact or build relationship within a minute, 5 minutes, 10 minutes. They interact with those people, those who are sitting within their compartment or neighbor to them. What is this? This is a skill. If you have a skill, then you can build a relationship. If you are not having skill, then for long time you cannot able to make a relationship. So in order to provide effective service of a social caseworker, you need to have the what type of skill you require? Skill in building relationship. Am I audible?
Yes, sir.
Okay, very good. The next one is skill in exploring problems. This is also very important. Exploring problems. Exploring problems means you have to interview with the client, you have to interact with the client and try to explore the information pertaining to the problem, related to the problem. Unless you are not exploring the information, you cannot give proper service. That is why you have to explore the information. So, exploring information also, or a skill in exploring problem, is also a skill. Therefore, internal problem, sometimes it may be the internal problem, sometimes it may be the external problem. So whatever may be the problem, that problem you need to be understood. That problem you need to be gathered from problem information you need to gather from the caseworker. Then you can able to provide proper service. Another one is skill in locating and accessing resources. Hmm. Locating and accessing resources. I have already said you several times that resources, it may be the materialistic resources, it may be the non-materialistic resources, whatever may be the resources. First of all, you have to identify the resources from the client itself. Whatever available resources within him, that resources you have to tap, that resources you have to utilize to solve the problem of the client. No need to explore other resources, no need to um, gather resources from outside. Whatever resources within him, that resources you need to utilize for the betterment of the client. So locating and accessing resources is very, very important. Locating means identifying the resources. Accessing means utilizing the resources. Where it is the resources, how you will apply, that is accessing. Resources is there, but we are not accessing it. Then what is the use of the resources? So that is why identifying the resources and uh, applying the resources is very important. This is also skills this is one of the skills which is comes under the social case work. Social case work. Skills in establishing the treatment alternatives. Skills in establishing the treatment alternative. Suppose one treatment is failure, another treatment you have to adapt. Another treatment is failure, you will send to somewhere else, that is referral services you have to give. So that skills also you need to have, otherwise you cannot able to provide a proper service. Okay, so mind it, my dear friends, this is some of the skills you may be facing. You may be getting some questions from the what are the skills of a social case worker. By the time you have to elaborate these many skills. Okay, so fieldwork practice with families. Now individual is complete, now we will come to the family. I will just uh, discuss only the important points because we have to cover the 4 units. So as far as possible, we will try to complete all these things. So family, you know, family is a consist of different members: wife, husband, son and daughter, father-in-law, mother-in-law, etc. If it is joint family, then also it is extended family, whatever kind of family. Family also having lot of problems. Yes or no? In India, we see different type of problems in family. Yes or no?
Yes, sir.
Yes, sir.
Okay. So now we will be discussing following are the guidelines for a student to do his fieldwork practicum with families. What are the guidelines one has to follow while he is doing family um, in while he is doing any kind of activities among the family? That we have to understand. One of the setting of our study is social work practicum is the family. So some of the guideline you need to follow while you are doing the uh, social work within the family setting. Family is a setting, individual is a setting. Now we are discussing the family. Collecting and identifying information is the first guideline. Collecting and identifying the information. What kind of family is it? Hmm. How many members are there in a family? Hmm. So these many things you have to collect from the family. Then assessing the client's needs in a family. Suppose one person is a problematic person, then what is they need? Or family as a whole, it is in a problem, facing problem. Then what is their need that we need to assess? Understanding the stages of family life cycle, it it provides an opportunity to the student to understand the stages of family is going through and its related problems. This would help the students learn the strategies used to cope up with the problems. That means what kind of problem is it going on, and is there any treatment is given for earlier before you, that you have to know. Then home visit. While you are doing any kind of mm, means personal service or family service, you need to visit to their home. That is home visit. Home visit means the caseworker will visit to their home. Unless you are not visiting to their home, you cannot understand anything. Learn to draw a genogram and eco, eco, eco map. The students can gradually engage in activities such as drawing a genogram or an eco map, as these activities will help the trainee to understand the problem from the perspective of family interaction with the environment. That means you have to know their environment. That means the family circle. That means their environment with the family, where it is residing. Beside, how many families are there? What is their behavioral activities? What kind of family is it? That you have to understand. Building leadership with the client. Hmm. Whenever you are trying to do any kind of activities, you have to build the leadership among the client. That means who is a problematic person, you have to capable enough to handle his situation. That's why you have to build the leadership with him, protecting confidentiality, developing attending skills, developing interviewing skills, etc., etc. These are some of the focusing on important issues is assessment interview, uh, assess, assessment interview, problem identification, the tasks of goal setting, working through the problem. These are certain things, termination, follow-up, and reporting. Last one is reporting. It is related to case study as well as related to family study as well. So everywhere in the last you have to report everything. Whatever you are getting information, that you have to jot down, that you have to note down. Or it may sometimes you may be maintain the audiovisual records also. If you are maintaining the record, then only it will help you to evaluation. If you are maintaining record, then it will help you for follow-up. So record maintain is most important. That is why while somebody says that you do a case study, so you have to undertake, you have to, you go for writing in a paper, so that you can able to know that the details of the family, the details of the client. That is why usually when we undertake casework for family as a setting for the field practicum or for the social work point of view, we have to furnish or you have to make a profile of a person. In family setting, you have to make a profile of a family, head of the household, and his age, whether he is married or unmarried, how many kids are there, what is their source of income, what is their problem. Everything you have to write down under this profile. Thereby you can know the real situation of the particular family, and after that you will go for providing the services. Fieldwork practice with communities. Now we'll come to the fieldwork practices community. Casework, group work, and community organization. You know everybody that community organization is one of the method of social work. So under the community organization, what we do, we intervene community problems. We intervene providing community services. So that way, this is one of the area. This is one of the setting. Community is one of the setting where we can apply, where we can practice the social work. So community, there are different type of communities. Say it is rural community, say it is urban community. In urban community, two type of communities are there. One is underdeveloped, undeveloped, and another is fully developed. Like in slum dwellers are undeveloped, and though the those who are staying in apartment and some other places, they are developed people. So you have to know which you have to know that in which community you are working. What are the problem of that community that you have to understand, right? So therefore, understanding the importance of people participation in implementing the intervention plan, understanding the unique needs of the different communities, prioritizing the needs and assessing the people's strength, to imbibe the skills required for practice in open communities, such as skills in interacting with people, conflict management, resource mobilization, etc., etc. To improve, to provide opportunities for the students to understand the features of the communities, urban, rural, or tribal. As I was saying to you, these are some of the communities, and these communities you need to understand. That means under which community you supposed to do some kind of activities. If you are not knowing the nature of that community, then you cannot able to provide the proper services. So therefore, this is very important. Again, in the community, you need to assess the community needs. There are different type of problem of the community. That is why uh, to identify the needs and problem of the community as well as the resources, the very important things. Identifying the needs and problems and resources. While you will know the need and problem and the resources, whatever needs you identified, you have to use those resources to mitigate their problem, to solve their problem. So therefore, this is very important aspect. Then you have to intervene into the intervene into that particular community. Means you'll start the activities of that in that community for the betterment of the community. So now we will be knowing some of the skills of while you are working in a community. By that time, you need to some of the skills identified which are relevant to the community based practices. One is engagement skills. This is one of the skill. So those that relate to establishing relationship with staff, local residents, and community leaders, being able to function in unstructured and sometimes chaotic situations, use of self in different action situations. So engagement skills means how you can able to interact with the community leaders, how you can able to interact with the um, office bearers or the NGO activists who are working in that particular community for the betterment of the community. You need to engage, or you need to talk with them so that your community problem could be solved. Organizational skills, how you are organizing the things for the problem solving the community, that is also very much important. Then planning and policy skills, then action skills, then communication skills, then political skills. See, political skills, those related to the ability to view local interviewing with the broader socio-economic framework, a knowledge of the sociology of political decision making, and a graphs of different varieties of political ideologies and their implication for change, centered action, ability to work with a political framework. What I mean to say, this is also very important. Suppose uh, you are working in a rural area, and there must be a sarpancha, there must be a ward member. So how you are interacting with the ward member, how you are exploring the resources from the sarpancha for the betterment of the community, that also sometimes betters your political knowledge, your political relationship. If you have a good relationship with the political peoples, you can get a maximum help for that community, and the community will get the benefit. So therefore, political skills also requires for a social workers. And then coming to the evaluation of the students. Hmm. Role of the faculty supervisor guiding fieldwork students. Orienting students to the agency help them identify with the agency and its objectives and clients groups. Make students realize the opportunities available for the students to learn practice skills. Holding regular conferences, individuals as well as groups, enabling students to share their learning experiences. This matter we have already discussed in the last classes. I think this is a repetition of this. Now, we will be discussing Unit 2. Okay. So, under Unit 2, we see medical, psychiatric, and child care. Understand? I think everybody knows medical. Do you know medical? Yes or no?
Yes, sir.
Okay.
Yes, sir.
Okay. So, medical is a broad area. Medical is a setting where you need to work, right? At present, medical counselors, one-stop centers, and some of the students working as a um, medical managers. Okay, so uh, social work students have a great opportunity, have a great scope to work in a medical sector, provided you need to have the medical knowledge. It does not mean, again, I want to make you clarify that doctor and social worker is different. Doctor will treat what aspect? The physical aspect. You will treat social aspect. You will treat psychological aspect. So you are also a doctor. Physical doctor is also, we are also doctor. We are physical, we are mental doctors. We are also social doctors. So disease does not comes only one sources. It comes through different sources. So different people when give services to a patient, the patient gets rid out of his problem. A patient get feel, a patient gets relaxed. Therefore, we need to also work in medical setting. So the social worker profession's earliest concern where the making healthcare services available to the poor and with the improving social condition that breed infectious diseases such as tuberculosis. As the social work role expanded, social workers joined other health professions in the delivery of high quality services. Today, social workers can be found in every component of the healthcare system. You know, there is a department NRHM, National Rural Health Mission. Most of the MSW students are appointed in NRHM, National Rural Health. I think some of you may be there, I don't know, in healthcare system. Yes or no?
Yes, sir.
Yes.
Very good. So, the medical setting is a very important setting. Roles and responsibilities of social workers in healthcare setting. Social workers working in healthcare setting should integrate theory and practices. There are different kinds of roles that we need to deliver in a medical setting. Social workers working in healthcare setting should integrate theory and practice. Okay. So essential areas of knowledge and understanding about healthcare include: what are the knowledge one must carry, one must understand, or one must have, uh, which will help him or she uh, to work effectively in healthcare services. Number one, the roles and functions of social work in healthcare, one must understand. The psychosocial needs of clients and families, one must understand. The psychological elements of illness and their impact on psychosocial functioning, the psychological and spiritual needs of clients and families, and how to ensure that they can be addressed, community resources to assist clients and families, laws, regulations, and policies affecting clients, families, and social work practice, evidence-based practice and social work research in healthcare, the needs of social populations, special populations. These are the some of the areas where a social worker or the supervisor need to have the knowledge. If he is getting the knowledge on this particular area, then his work activities will be effective. One, assessment and intervention of strategies. Past and current health status, including genetic history of family health, the impact of health condition or treatment on cognitive, emotional, social, psychological, and physical functioning, social history, including current living arrangement and household environment, work, school, or vocational history, stage in the life cycle and related and relevant developmental issues, financial resources. These are all related to your health issues, medical issues. So this aspect also taken into consideration there while you are dealing with the medical activities. Intervention plans may be include intervention through interdisciplinary input. How you will intervene into a medical issues, how you will intervene into a medical setting, that is very much important. So, strategies to address needs identified in the assessment, information, referral and education, individual, family or group counseling, vocational, educational and supportive counseling. These are some of the interdisciplinary input in medical setting. Addressing clients' multiple needs. How you will address the multiple needs this of the particular clients who are in a medical need, who are in the medical required of the medical services. By that time, you need to know some of the scope of services which would include, such as psychosocial assessment, including diagnosis, intervention, and treatment plans. This is psychosocial assessment. Financial assessment, planning and intervention, case facilitation, client and family counseling, crisis intervention, quality improvement, resource mobilization, outcome evaluation, teamwork, client family education. These are the some of the scope, means some of the area where you can provide the medical services. So out of these scopes, I must tell one thing: crisis intervention. Crisis intervention means while there is a crisis, your immediate intervention is crisis intervention. There is a family, and with that family, suppose the bread earner is already passed away, means death. So the family will go through the crisis. So by that time, you need to intervene into the crisis. While you are intervening into the crisis, automatically the family will be stable. Suppose somebody is affected by the chronic diseases, whatever may be the chronic diseases, and they are suffering by economically as well as socially. So by that time also you need to intervene immediately and try to solve the problem of the particular client, because uh, at some point of time the client does not know where to go, how to mobilize the resources, what he will do, he does not know. So you have to show the direction, you have to show the path, you have to show the the answer to him for his service. Now social workers should engage in health education. As I was saying to you, that you need to have some health related educations. So unless you are not knowing, suppose malaria, suppose tuberculosis, suppose HIV AIDS, suppose uh, any other diseases which is very important disease related to that disease, you need to have some knowledge. And if you are not knowing that knowledge, you cannot able to provide the service. You should also know the different policies and programs of the government, different schemes of the government, health related schemes, so that you can able to provide effective service to the needy peoples. Now, social workers should maintain records or documentation of social work services related to the medical services. The elements and responsibilities of through and comprehensive documentation include the following. What sort of documentation you are supposed to maintain? Comprehensive assessment and services delivered to the client and client systems, including the development of a plan of care. Those who have medical knowledge, you must be knowing that doctor, when you get admitted in any hospital, doctor prescribing different prescriptions, including your profile. Okay, so doctor is advising that you need to keep all these records, because the record will provide you, the record will help you to further treatment. So therefore, this is very important to maintain the records, as I was saying to you. Say it is in the case study, say it is in the family study, say it is in the medical study. So whenever you go, whatever the settings you are working, you need to maintain the records. Record is two type. One is personal record, another is official records. For your personal reference, you have to maintain some record, and for the official, you have to maintain some records. But record maintaining is inevitable. If you are not maintaining the records, then your services is meaningless. What kind of what sort of things you have to note down in the record? As I was saying to you, that uh, you have to maintain the record of the development plan and services rendered by you, treatment given by you, what kind of treatment already you have given, and again what sort of things are required for further treatment. That record you have to maintain. Ongoing assessment, intervention and treatment planning, that also very much important for the documentation. Referral sources and collaborations, dates, times and description of client and client system contacts. You have to maintain the date, you have to maintain the time, by what time you have met to the the client, that you have to maintain. Also date, also what kind of discussion you have made with him, that also you have to maintain. Documentation of outcomes, whatever outcomes. Again, I want to say that in input, output, outcome and impact. Whatever input you have given, and what kind of outcome comes, that you have to maintain, or that you have to write down. Reason for case closure or transfer. Written permission to release and obtain information wherever appropriate. Now, Now we'll be discussing uh, the areas for practice in healthcare, social work. Hmm. Medical social worker acts as the doctor of doctor's mouthpiece and furnishes information to the client about the following his or her illness. I was saying to you uh, कि the social worker acts as a mouthpiece of a client. On behalf of the client, he narrates some of the social aspect to the doctor because the disease must be attached attached to social aspect. So therefore, you need to explain all these things. Now, prior to this, uh, we can see some of the major areas where the social worker deployed in healthcare services, such as uh, uh, general hospitals and medical colleges. Social workers are placed in psychiatric hospitals, child guidance centers, cancer hospitals, family planning clinics, drug de-addiction centers, blood banks, etc. Social workers are also working with the community outreach programs of hospitals and non-governmental organizations. These are some of the areas where the social workers are working. So, in Odisha also, some of the social workers are working in cancer hospital for palliative care services, giving palliative care services. I have interacted with some of the students, though you must be knowing, those who are from Odisha, they must be knowing that Subrat Bakchi has donated some crores of money for cancer hospital. It is under process, and some of the social workers are working there and visiting to door to the cancer patients. So, and some of our social worker students are also working in medical. If you go to Capital Medical of Bhubaneswar, there is a madam. She was my student during in IGNOU Utkal University. So she did her MSW course from Utkal University, and um, few days before I had been to Capital Blood Bank, and she saw and me say, "Sir, I am your student." So I felt very proud that she's working there. So likewise, many students are working in different places uh, in medical sector. So drug de-addiction center also you have the scope to work. Cancer hospital, family planning clinics, child guidance centers, and psychiatric hospitals, where our social work students are deployed. So these are some of the areas where social workers are working. Now, social workers in the area of psychiatric health. Now we'll come to the psychiatric health. Uh, psychiatric is related to mental issues. Okay, social workers in the area of psychiatric health and substance abuse assesses and treat individuals with mental illness or substance abuse problems, including abuse of school, abuse of alcohol, tobacco, or other drugs. Such services include individuals and groups therapy, outreach, um, crisis intervention, social rehabilitation, and training in skills everyday living. So, the psychiatric social worker makes thorough study of the environment of the client, covering such aspect of home, work, and social life, and brings out significant facts which have some bearing of his maladjustments. So, there are some psychiatric schools. There are some um, psychiatric institutions who are providing psychiatric services in different settings. In Odisha also, in some other places also, there are so many organizations who are working in psychiatric setting. But prior to that, you must have knowledge on psychiatric. So in Kotak, there is a MPhil in psychiatric. In Kotak, in Odisha, there is a MPhil in psychiatric course is there. So after the MSW, you may be also uh, pursue some psychiatric special courses. But if you are not reading also, then also you can work in the psychiatric setting uh, as a psychiatric social worker. So psychiatric social workers also, just like in medical social worker, he also tries to know the mental status of the persons, why they are getting disturbed, what are the factors, root causes of the disturbance. They try to find out all those things. Student psychiatric social work, nursing students, medical students, and staff of the agency, where the psychiatric social worker is employed as a mental hygiene supervisor or consultant, may participate in the training program. So, they may be studying at the mental hygiene. What is the problem for which this person is psychosomatic disorder, mental disorder? So, there are different factors which working for this particular region. Psychiatric social workers maintain social records for the purpose of social statistics. A full report enables a worker to diagnose the social problems better and check up for social treatment plan. This is what we are saying, the psychiatric social worker. In Odisha, only one institutions are there where the psychiatric social work education is imparted, that is Kotak SCB Medical, and in Bihar and some other states also, they are also imparting. So special education is required for rendering the, psychiatric social work services. So what I mean to say, psychiatric also one of the setting where the social worker can deploy it, where the social worker can work. That is why this setting is also mentioned in your book. So you need to also work in family setting, you need to also individual setting, you need to also work in medical setting and psychiatric setting. Psychiatric setting, one of the branch of medical setting, is the part of this medical setting. So you need to have some extra knowledge while you're dealing with the psychiatric people. Medical is commonly social workers can deal, but while you are dealing with the psychiatric, you have to have some extra knowledge on that particular subject. Role in the programs for elderly, role of the child guidance clinics. So you need to have some different type of roles in suppose elderly means geriatric care centers. For example, you are working in a old age homes. There, what would be your role? How you will play the role so that the people, the geriatric people will get the proper treatment. So we are saying the gerontology. You must have heard from the you must have seen there are many NGOs getting support from the central government as well as state government to open the geriatric care centers where the old people are kept, male, female. They are taking care of helpless old peoples, those who have no family members and their children, their son and daughters are not responding to them. Those kind of people are there in that particular area. Role in the child guidance clinics. Most of the child guidance clinics are either part of the Department of Psychiatry of General Hospital or run by social work, social welfare agency. With regards to the staffing of the child guidance clinics, most clinics followed the team approaches and are staffed with psychiatrists, pediatricians, psychologists, social workers, play therapists, speech therapists. These are some of the uh, child guidance clinics where these type of people are deployed, means working. Okay, so out of which social workers also deployed. Social workers, it is his designation is a social worker. Some of our those who have studied psychologists, they are the psychologists also there. Pediatricians doctor, they are also there. Mm. Psychotherapists also there. Speech therapists, suppose a child is not able to speak, there must be a speech therapist must be there who will deal with the speech, that how can that child can speak easily, that he will give treatment. And sometimes also you know uh, there is another treatment that is in Olotpur. What kind of treatment is given in Olotpur? Hmm? I forgot that one.
सर हाड़ाभंगा ट्रीटमेंट जो
Hmm.
बोन जोड़ा ब्रोकन बोन पाई
Yes. Um, treatment, the name of the treatment, what is that? I forgot. Anyway, so physiotherapy, that is physiotherapy, right? So there is a physiotherapy. That treatment is also there in child guidance clinics. So different type of treatments must be given in the child guidance clinics, where social worker is one of the part. Now, the routine daily activities at the clinic consist of what kind of routine one has to obtain. I'm not going in details because time is very short. That's why I'm just going to tell you only few lines. That is registration of a new cases. Registration of a new cases means when a child comes to get the treatment, new child comes, by the time he or she has to be registered. That is registration of the cases. Review of old cases, whatever whatever treatment earlier she has got, that you have to review. Then only it will be easier to provide the present services. Psychiatric evaluation, individual psychotherapy for the child or his parents, group psychotherapy for the child or his parents, play therapy, speech therapy, group therapy, etc., etc. So these are the some of the uh, important aspect in the clinic that you have to abide. Social workers and community health. This chapter is also very important. Hmm. Community medicine. Sometimes we are saying community medicine, right? So social workers, community health. That means there as we were discussing that there are different type of communities: rural community, urban community, tribal community. Varieties of communities are there. Variety communities having varieties of problems. You cannot say that only one kind of problem is prevailing in every communities. It is no doubt there are some similar problems are there, but variety community have variety problem in a specific geographical periphery. Among a specific group of people may have some kind of problem, which we will solve the problem through providing community health services. That is why social workers and community health in a specific community may have specific kind of problem. So that problem need to be addressed. The term community health refers to the health status of a defined group of people, as I was saying to you, or community, and the action and condition that protect and improve the health of the community. Those individuals who make up a community live in a somewhat localized area under the same general regulations. norms, values, and organizations. For examples, the health status of the people living in a particular town and the actions taken to protect and improve the health of these residents would constitute common community health. The actions and conditions that protect and improve community can be organized into three areas, that is health promotion, health protection, and health services. Try to remember these three aspects. In a community services, you have to work in three areas, that is health promotion. What is health promotion? You need to make the health awareness among the community people. People will you have to sensitize the health related aspects so that people will make it aware. Then health protection. Before before getting into any kind of health hazards, they need to take some measures. So prevention is better than cure. So that type of activities you have to take care of those communities. And providing health services. Health is a aspect you cannot expect by at any point of time, even though you are health conscious, then also you may be falling any kind of problem. So therefore, health services need to provided to those community people. Say for an example, organizing the health camps, eye camps, dental camps, immunization camps. These camps you need to organize among the community people, which comes under community health services. Hmm. So if you are providing such type of services, the community will be remain healthy and wealthy. Because in health we spend thousands of rupees, lakhs of rupees, knowingly as well as unknowingly. So we must aware of the health services so that there would be no any problem of the community people. Then the factors that are included in each category and an example of each factor are noted. What are those factors? Physical factors. In community health services, what are the factors causing in a community? One is physical factors, another is social and cultural factors, community organizations, and individual behavior. These factors affecting to the particular community to become a health hazard, to um, to fall in health hazards. These factors. Okay, so these factors we need to see properly. And the very important thing is that in order to protect those community, we have to see the health promotion and see the health protection. One is health promotion, another one is health protection. Health promotion, you have to make aware of aware the people uh, to have the nutritious foods so that they can protect their health. And another thing is that protection also you can advise them to drink safe drinking water and living in hygienic environment. These many things is also very much important to tell them so that people will make aware and they will be not falling any kind of problematic situation. Role in mother and child health, adolescent health, tuberculosis. Uh, MMR and IMR, infant mortality rate and mother mortality rate, you must be knowing. So we should also promote the mother healthcare services and child healthcare services, and thereby the child and mother both will be remain healthy, and our society will be progress. And some adolescents, I think up to 17 to 19 their age group are coming under the adolescent groups. So adolescents may have some different type of problems. They may be affected into drugs and alcohol and some sexual. There are some sexual risks and some health hazards there among the adolescent groups. So we need to taking care of them, or we would also handling their problem. And tuberculosis. There is a department in medical also. Tuberculosis, or in short TB, should be considered as a public health problem of major importance. It is a public health services. Through the public health services, we will provide some sort of medicine and some sort of awareness so that the people will get free out of this affecting with the tuberculosis. At present, I think many of the people are not affected by the tuberculosis because of the uh, consciousness, health consciousness. And another public health services is leprosy. I don't want to discuss more on this. This is very old concept, and you must be knowing all these things. Leprosy. There is a medicine for for leprosy. There is a medicine. Okay. Do you know what is the some of the medicines are there for the leprosy? If somebody is taking the medicine, then he will not affected by the leprosy. So these are some of the uh, community health related aspects that we need to understand. The health care social workers are increasingly employed at hospitals, tuberculosis clinics, sexually transmitted infection clinics, leprosy clinics, family planning clinics, cancer control clinics, mental health institutions, pediatric departments, uh, rehabilitation department of spinal injury centers, cardiac care clinics, diabetes control clinics, mother and infant health centers, school health services, drug de-addiction centers, HIV/AIDS education, prevention and control centers, integrated counseling and testing centers, blood banks, organ donation centers, health related community outreach program, etc., etc. These are the some of the areas where the health workers or social workers are deployed or getting employment. Okay. And I was discussing with you about the CCI center, child care institutions. There also our MSW students or professionals are working as a superintendent of the CCI center, and they look after the different aspect of the particular children's, starting from enrollment to providing the basic amenities to the destitute children. The destitute children mostly they get admitted in that particular area. Then we can also work among the child labor. We can also work among the girl child. We can also work among the child trafficking, child prostitutions, brothel homes. Hmm. There are some areas, childs are trafficked, kidnapped, and in some places they are used for sex workers. Childs are also working as a sex workers. So therefore, we need to counsel them. We need to educate them to their parents, as well as uh, if anywhere we found there is a child helpline, there also you can report, and the police and some of the organizations, they will rescue to the child, and they will provide the educational support to the particular child. So or suppose a child is in a home and their parents are abusing him, or sometimes a child may be abused in a school or some other places. or in the community. There also our roles are there to identify the child abuse and to report to the concerned department so that the child will get the relief and child will get fit. Now we'll come to the education and research. Unit 3. Friends, social workers practicum in the education sector. The field of education covers a wide area and encompasses a different age group and thereby provides scope for social work intervention. Education levels range from preschool to collegiate education, and research institutions as well as adult and continuing education. Non-formal educational channels incorporate literacy and post-literacy program. Distance education, open education, online education, and other recent trends involving information technology. Social work initiative at preschool level. Educational programs for preschool child include Anganwadi Kendra, children play centers, daycare centers, and creche and pre-attached primary schools. It means, as a whole, if we can say that in education also there is a role of a social worker. While a children is drop out, by the time it needs the help of the social worker. Why the children drop out? Why the children is abused? Why the children are not getting proper education? Everywhere there is a need of a social workers. There are some different institutions like Anganwadi Kendra and creche centers, play centers where children are getting education, taken care of. So in that educational institutes also, there is a role of a social workers. That is why their presence is required. In college level also, for the counseling purpose, in undergraduate level also, postgraduate level also, in high school, primary level, everywhere the need of a social workers are required. Preschool activities have been classified into the following 5 sections. I am not going in details. Activities for physical development, activities for language development. Here, the social workers can also have a greater role in order to promote the child education. Child education is not only reading and writing, but also a child need to grow socially and educationally. So social aspect, in somehow educational aspect, also being guided by the social workers. I'm not going to elaborate on role of the Anganwadi worker in a preschool education because we have to cover some other chapter also. This is very easy that if you can read out and understood all these things. School social work, implication and possibilities. Beginning in school social work. So, social work services were first established in the school of Boston, Hartford. So, not necessary this chapter. Nature of school of social work, where we study about the child, family, school staff, the community, etc. And thereby we get some knowledge to provide the services of the uh, services for the needy students. Tasks for the school social worker. What are the some of tasks and responsibility for the work in the schools? What kind of tasks a social worker need to discharge? That is, the social worker should facilitate the provision of direct educational and social services to pupil. মানে pupil means students. The social worker should focus on the urgent needs of selected group of pupil. Selected group of pupils mean, suppose in a school, scheduled caste students are reading, children are reading, as well as tribal children are reading. Who are vulnerable? Both are vulnerable group of the children. So these children's need to be addressed. There are some other higher group children may be also there in the community, a school. So then not required your need. But some specific group of children who need to be identified by you and they need to be taken care of by you. So that the education, they will get the education and they will improve in their educational system, which will be which one is a very important part of your role that you have to perform. Knowledge appropriate for the tasks of schools, social workers. Knowledge of the school. A social worker must have know some of the knowledge on the school. Knowledge on the school means whether it is a primary school or upper primary school, what is the pedagogy of that particular uh, study curriculum, that also a social worker must know. If it is not knowing, and also should know the government provisions for the pupils, for the children, that also he should know. Then only he can assist to the children. University, college students, and youth groups. Characteristics of youth I don't want to discuss with you. It is very common for all the persons. Those who are studying in university, college, and out of the college, some of the youth are there. You need to work with them. I will cite some example that you must be knowing, that the NSS, National Service Scheme, Bharat Scout and Guide, NCC, these are some of the youth department, who are working in youth in college level, undergraduate level also. And for the non-collegiate students, there is a NUIK, Nehru Yuva Kendra. You must have heard this, the department coming under the Ministry of Youth and Sports Affairs, who are dealing with the youth's problem, youth development. Okay, so you must be working among the youth also. So for youth, what are the privileges given by the government? What sort of the privileges they get from outside? That also you must know. The content of the program will depend upon the educational attainment and needs of the youth. As many young persons will be workers, a strong vocational element will have to build in all educational programs. New vocational skills will enable them to improve their economic status. So sometimes in a college or university levels, there are some vocational training also going on. What is that vocational training? Computer education, spoken English courses, data entry courses. These vocational schools will be taken care by the MSW students. You have a lot of chances to work in that particular field. There are many government or non-government organizations who were running some of the vocational education in government colleges, non-government colleges, schools, where the district level coordinator will be only MSW students. This is a very, good news for the MSW students, that the government has completely restricted that only the MSW candidate will be the district coordinator for vocational education. So he will monitor all these things. Under him, around 15,000 rupees the teachers are getting, and he will get around 25 to 30, more than 30,000 like that. So he will monitor in those particular areas. So these type of schemes are also going on, where this is related to education. Apart from your academic education, you need to they need to impart some vocational education, which will be guided, which will be directed, which will be supervised, which will be monitored, which will be also programmed by the social workers. So you need to have the good knowledge on that particular things. Then you will be deployed in that particular area. Adult and continuing education. This there is a department, State Social Welfare Board, Central Social Welfare Board. How many of you know State Social Welfare Board? Do you know State Social Welfare Board? Hello? Hello?
Yes, sir.
Sir, no idea, sir.
Anybody know State Social Welfare Board?
No, sir.
Hmm? No. Hmm. So try to know State Social Welfare Board. There is a semi-government organization is called State Social Welfare Board, which is running by Central Social Welfare Board, and they are working for the women empowerment, community development, and especially in education. Condensed courses they are providing. You must have heard working women hostels are there in Bhubaneswar and some other states also. It is controlled, it is under the jurisdiction of State Social Welfare Board. Okay. And they are also supporting to some small NGOs for some programs also. So please try to know all this thing. I think in a theory paper this chapter is there. I think I'm forgetting that one. Another one aspect now we will be discussing, that is social work practicum research settings. There is an option in MSW. Earlier there was not that type of options, but I think before 5 to 6 years this option has come, that MSW student has to prepare a project report. Project report is a small research work. You have to undertake a research study, and after that you will go for preparing a project report. Understand? So research is a very important part of our social work study. Field practicum, survey is also comes from the research. You have to explore some information related to some problem and find out some solution through the research methodology, through using the research methodology. So therefore, you have to select a topic, and based on that topic, why you selected that topic, you have to write, and then you have to specify some of the objective. Then you will go for the review of literature. Then you will come to research methodology, data collection, primary data collection, secondary data collection, inverse, and sampling, sample size, expected findings, bibliography, everything you will incorporate in the research. So here it is very important. Important thing is that being a field practicum students or MSW student, you have to do some small researches. Unless you are not doing research, you cannot get the knowledge. Therefore, research is very important. Social work research, nature and scope. Social work research is the use of the scientific method in the search of knowledge, including knowledge of literature, alternate practice, and intervention techniques. Social work research is the species that belongs to the category of social research, or more specifically referred to as social science research. So in research, we get some knowledge, and through that knowledge, we try to solve the problem of the communities, try to solve the problem of the family, try to solve the problem of the individuals. Functions of the social work research. Social work research basically deals with problem faced by professional social workers, social work agencies, and the community. In social work research, the study of a problem is done from the point of view of professional social work. As such, the research design, data collection, and their interpretation will have to be attempted in a manner as will be useful to professional social workers, which I have already discussed with you. Hmm. So, research is a part of your study curriculum. Research is the part of your field practicum. You have to do some kind of researches. So, in mm, in due course of your field practical, you will be doing this type of things. I was discussing with the content and methodology. Already I have discussed with you social work research in India. Research for the um, stunted growth of social work research in India are many and include the following: inadequacy of funds, shortage of research personnel, inadequacy of research facility. See, what it is written here, that in India there is a research. Students are doing the research work, but less number of research work is going on. Authenticate research is not going on. It is because of inadequacy of funds. For the research, there is a require of funds. And as much as you are doing research work, definitely your problem will be solved. Definitely will be strengthened. Hmm. Research personnel is also lacking. So therefore, this research work is not um, up to the mark. So therefore, this is the area where we need to work effectively, so that the research will be the full-fledged one. Difference between the evaluation, basic research. So type of evaluation research: internal evaluation, external evaluation, joint evaluation, need for program evaluation. Okay. Now we'll come to the uh, unit 4, that is correctional services. Now, history of prison of India. Lord Mercury. I'm not going to this one. I will just tell you the important aspect of this chapter. Uh, okay. So, dear friends, this chapter is based on correctional services. What do you mean by correctional services? Anybody can speak? Do you know what is correctional services? Hmm? Anybody can say?
Sir, sir, in jail there is a correctional services for juvenile peoples.
Hmm. Okay. Correctional services, such kind of services, people those who are addict with, people those who are associated with criminal activities. Understand? And for their reformative, correctional services, reformative services, in order to reform them, in order to reform their behavior, in order to recorrect their attitude, we provide some sort of correctional services, keeping in the jail. A person, suppose he killed someone or theft something and kept in the jail. Sometimes there are persons who are not intentionally do that work. Unintentionally also, by mistake also, they do that work, kind of activities, and they are in the jail. So there is a probability of change of their mindset. In the jail, you must be seeing there is a open jail. Who are kept in the open jail? In Jharpada, there is in Bhubaneswar, there is Jharpada jail, and beside that there is a open jail also. In open jail, no police are deployed. They are openly moving here and there, and again they are staying in the jail jurisdiction, but they are not going run away from outside, because they have already corrected. So therefore, there in that particular area, there is a there are some people who are deployed as a jail welfare officer. The MSW students are employed. The MSW students are deployed as a jail welfare officer. So they work among the jail inmates, not only juvenile delinquents. Adult people are also there in the jail, and how they will correct their characters, how they will come forward again the mainstream of the society. Those things are done by the jail welfare officers. So this is related to correctional services. Understand? This is related to correctional services. A jail welfare officer will recommend to a jail superintendent that this jail inmates is already confess his guilty and is repenting. What will happen? Automatically, his tenure of jail imprisonment will be decreased. This is also there is a rule. So this is this type of activities we are saying the correctional services. Another aspect, as you were saying, there are some childrens, those who are kept in the jail. Children are those who are indulged with juvenile delinquency. They are called as juvenile delinquents. They are called as juvenile delinquents. JJ, Juvenile Justice Act. There is a book. If you read that one, then you will know that what is their provision for them. For this juvenile, there is a special jail, special jail, special court where their cases will trial, where their cases will be examined, and there also they will be imparted the education. There also they will be imparted the vocational education like that. In juvenile jail also, in the central jail also, big jail also. So these are known as the correctional services. Treat prisons in a manner which is human, decent, and just. In administrative point of view, while you are dealing with a jail inmates, jail bandi, there you have to treat them as a human being. You have to show the decent behavior, just behavior, because they are, after all, they are human being. They may be committed any kind of mistakes, and they are kept in the jail, but still they are human being. We have to treat them as a human being, not as an inhuman being. Next, correctional social work, and that I was saying to you. Suppose some of the children are indulged with pickpocketing. They are indulged with drugs, and the consequences is they will be involving in docket and some other activities. So that type of to bring them into mainstream of the society is also the work of the correctional services, social work services. So some of the children, some of the people are in the probation care, and after the probation, after care, there our social workers need to be deployed and do the activities. Some of the important skills and techniques of social work with the clients are, while they are dealing with the um, correctional services, by that time, counseling capacity they must be knowing, insight and empathy, interviewing the, and another, in correctional setting, there are few issues which must be kept in mind. While you are dealing with a correctional setting, by that time you have to kept some of the points, some of the things which is very important, that is the captive client. The captive client. Here, the client, because of the constant setting, is captive. Presence during the sessions is not voluntary and somewhat imposed. Hence, it is a very responsible process, and the whole environment should be lighthearted. lighthearted. There is needed a structured, permissive relationship between the client and interviewer. This relationship should allow the client gain an understanding of himself to a degree which enable him take positive step in the light of a new environment. Stigma and self-esteem is also uh, one of the aspects that you need to understood. Don't go through any kind of blind belief. That is stigma. If you have some kind of stigma, then you cannot provide proper service. As well as if you are maintaining the self-esteem, then also you may not be able to work comfortably with the delinquents or the criminal kind of activities people. So now, role of NGOs. There is considerable scope of NGOs and voluntary agencies to work in the field of treatment, after care and rehabilitation of offenders. If the service of well-organized NGOs could be obtained on a regular basis, it would be desirable to assign a role for them as visualized by the Mula committee in regarding to the following. So, the role of NGO is also very important in dealing with the uh, correctional services. The NGOs also, there are some registered NGOs who are also doing some correctional services, keeping the people in their jurisdiction with their home, and they are giving some kind of services in through the NGO or non-governmental organization. So they also identify some of the people, and they also keep in touch with their social counselors. They goes to that particular place, and they meet with them, those people, and try to solve their problem. Uh, Corporate and sector and donor agencies and NGOs. So, friends, there are many corporate sectors like, I will tell you, OMC, Orissa Mining Corporate Corporation, NALCO, Indol, Vedanta, Posco is already, I think, not working. There are some multinational companies who are also working in different sector, where also you will be worked, because the corporate sectors spends the crores of money for the welfare of the people. So there also the social worker may be deploying. There also you may be working as a social work ready for your field practicum. So you must be knowing that in corporate sector there is a corporate social responsibility, CSR. We are saying it is CSR. Under the CSR project, the corporates are working for welfare program directly as well as indirectly. They are also funding some funding to the NGOs, and they are also working directly. Suppose Tata Trust. You must have heard Tata Trust. Tata Trust is working directly for the betterment of the people, establishing the schools, colleges, hospitals, like that, where the social workers will be deployed, where the social workers have an avenue. So that is why I said, no, this is the setting. Corporate sector is a setting where the social workers will be observed, and they will work for the community people. They will work for the district people. They will work for the some segment of the people who are vulnerable group of the society. So they are also their project may be in the areas of livelihood. Their projects may be in the areas of environment protection. Their projects may be in terms of the education. Whatever the projects, they require the help of the social worker. So in corporate is also one of the sector or setting where the social worker can be observed. Another sector is donor agencies. We have different type of organization: international organization, I organization, national organization, state level organization, district level organization, and some CBOs, community based organizations. Beside this organization, there is another nomenclature there are some international organizations who are named as a donor agencies. What is the role of a donor agency? Donor agencies donate the fund to different agencies, I agencies, national agencies, state agencies. Through that state agency, they work. Through the state agency, they try to work for the development of the community in different areas. Where in the donor agency also a social worker will be deployed. In the donor agency also a social worker will be deployed, and what will be the role of a social worker in the donor agencies? He will find out some agencies, suitable agencies, to whom he will grant the donation. There are different stakeholders are there. They will apply for the funding. Then out of those agencies, he will suggest this agency is appropriate one. And in the donor agency, the social worker will act as a supervisor, act as a monitor. He may be, to whom the donor agency is providing donation or funding, the social worker will go and check. The social worker will go and verify whether it is implemented properly or not, and he will report to the donor agency. So that is the main part of the social worker. And beside that also, he will see that what is the impact of that output of that particular donation. Everything he will look after. That is why to mobilize the monetary resources from corporate, individuals, donors, and interest groups. While a person is working in the donor agency, his another major work is that he has to mobilize the resources for the donor agency. How the donor agencies are donating to all other small agencies? How they are getting the resources? They are also mobilizing the resources. They are donor agency, but they are mobilizing the resources and supplying the rupees to others. So the social worker will act to mobilize the resources from the corporate sectors. The social worker will act to mobilize the resources from the individual donors. Suppose Amitabh Bachchan. Suppose in a city there is a big rich person. He will go and ask to him individually, and he may be giving some sort of money through which he will donate some money through which the charitable activities will undertake. So the individual will donate to the donor agency, and donor agency will donate to the other agencies who are working in different fields. Beside that also, interest group. There are certain interest group who are very much interested to donate for the cancer patient. There are certain interest groups who are very much interested to work in educational sector. There are some interest groups, those who are working for interest to donate for the orphan children. So likewise, there are different type of interest groups are there. Those interest groups need to be identified. Those interest group need to be selected, and the money need to be mobilized from them, and that will comes to the donor agency through the initiative of a social worker, and that will spend for the development of the other people. The select NGOs that are creditworthy, efficient, and have a positive image among the targeted groups. To fund the agencies selected the monitoring the progress that I was already discussing with you. Evaluating the follow-up. Evaluation and follow-up is also there by the donor agencies. It will be also done by the social workers in collaboration with other members. Activities in donor agencies. Students can perform the following activities. Understand the politics of aid mobilization and aid distribution. These things also students need to be understand. When I was a student and at present also sometimes I see there are some organizations they are wondering for a staff or MSW staff for resource mobilization for their organization. Big organizations are doing such type of things. You go for UNICEF. UNICEF is searching candidates on behalf of UNICEF. UNICEF is working for what? Basically, UNICEF is working for child development. Yes or no? So they require some
Yes, sir.
funds. They require from some funds, and you have a space to work in UNICEF. When the people, when a person or corporate sector or any other person where you will go for donation mobilization, by that time on behalf of the UNICEF, definitely somebody will interested to give the resources, funds, because the organization itself is a strengthened organization. The organization is a very good organization. That is why people will not reluctant to provide the resources. Okay. So, friends, you have any question? This today is the last class. I have almost all chapter completed. Today we discussed about uh, uh, today we discussed about the casework uh, and casework, family work, case, family, and community. Okay, so these are the some of the settings: individual setting, family setting, and community setting. As a social worker, you may be doing work among the individuals, which we call casework, family, and community also, community service, medical and psychiatric and child care, education research, correctional services, corporate sector, donor agency, and NGOs. Today we covered 5 units. So these are the broad areas. I think you must have got some information. I may not have that much of time to explain in details because it is not possible within 2 hours to explain everything. But in nutshell, I have tried my best to say something, and you should go through details of this chapter and you will tap the privileges. So I think there are huge number of job scopes. Some of the students, MSW students, they say, sir, where we will work? MSW course has no job scopes. Yeah, plenty of job scopes are there. The thing is that what is your subject area? What is your expertise in that particular field? You need to have expertise in that particular field. Suppose you want to work in every district, there is a district child committee. Yes, state child committee is there, where MSW students has a lot of chance. Juvenile Justice Court board member also, you may be applying for that board member also. So in the child CCA center also, um, I'm talking about the CA. I mean the job scope. Friends, once upon a time, I will tell the now Madam, she's working as a PG Council Chairman, Nivedita Ratha, Dr. Nivedita Ratha. She is Utkal University. He said, Mandal sir, it is, I'm saying you 5 to 7 years back. She said, I was a jury member to select the jail welfare officer, but MSW students, I didn't find any MSW student over there for interview. So we gave some MBA students. She said like that. See, MSW students are also not available for some sort of job. Even though you are available, but you do not have the capacity, that is also problem. She said candidates were not there. So job are available, but you need to fit into that job. You need to have some extra knowledge on that. Suppose you want to work in correctional social service. There is some courses, online courses, some other courses. You need to have some basic fundamental knowledge on that particular subject. Then only you will have work in the correctional social services. Likewise, there is some educational services is also there. Psychiatric setting is also there. Some of my students, they pursued this MPhil psychiatric in Kotak and some other places also, in outside the Odisha, and they are now earlier at present